Show for rheumatoid arthritis. So we have 4 sections. We're going to be doing pathophysiology of RA, clinical manifestations, system impact on organs, and head-to-toe assessment. And so we have 3 contestants. We have first Sean over here, and then we have Haley, and then we have Mallory. You guys want to introduce yourselves real quick?
Hi, Sean.
I'm Haley. I'm Mallory.
Okay, so we're going to get started. We got to figure out who's going first. So I'll have you guys do rock, paper, scissors.
Oh, 1, 2, 3.
Okay. And Sean will.
Yeah.
So Sean will go first, and then you'll go second, right? And then Haley will go third.
Yeah.
Okay, cool. So Sean, what do you want to do?
Let's do head to toe for 100.
Does RA affect the lining of the joints? Yes or no?
Yes.
That is right.
Yay.
Sean, you have 100 points.
Yay.
Okay, Mallory, you are up. Which one do you want to go with?
Let's do clinical manifestations for 100.
Okay. How many stages of RA are there?
I believe there are 4.
You are correct. Okay, Haley, which one do you choose?
I'll do clinical manifestations 200.
What age do people typically develop RA?
30 to 60.
That is correct.
Amazing!
Okay, Sean, which one?
Let's do system impact for 500.
Ooh, big money. What are the terms for when the condition becomes more active in periods of time when it becomes less with no swelling?
I got nothing.
Okay, no points for Sean. The answer is flares and remission. Sean is no longer in the lead. Just kidding. Okay, Mallory, which one do you choose?
Pathophysiology of art.
And then which number?
100.
100. What is RA?
And autoimmune disorder.
Correct. Okay, Haley, which one do you choose?
System impact on the organs 200.
What systems does RA affect as the disease progresses? You only have to name a few.
Well, the joint, or the muscular, and
Is that your answer?
yeah, muscular.
Okay.
You're thinking about, the actual like.
So it actually affects the wrists, elbows, hips, knees, and
I
ankles.
just thought you meant the system.
Oh,
My bad.
unfortunately, no points, but
Yeah,
you got the
that's
next
okay,
one.
Yeah.
Sean, which one do you choose?
Pathophysiology of RA for 200.
What causes RA? Just name a few.
Genetics
Mhm.
and aging.
Correct.
Amazing!
And hormones and environmental factors. And you give me 500.
Okay, Sean, you're at 300. You are in the lead. And then we have Mallory. You're up.
Clinical manifestations for 300.
List at least 2 main signs and symptoms for RA.
Joint stiffness
Mhm.
and is it tenderness?
Yes, that is correct. Mallory is in the lead. And then Haley, which one do you choose?
System impact 100.
What major systems does RA affect?
The system this time will be just the joints, the muscular, or.
Mhm. Yep, it affects the joints.
Yeah, joints.
That is correct. Okay, Sean, which one do you choose?
Head to toe for 500.
Wow. Okay, list 4 other complications that someone with RA is at risk for getting. This is the hard one.
Swelling. Stiffness. Fractures.
So these are complications, more complicated complications. Like these are things that long-term use could cause.
Immobility.
Think of like other diseases that RA could lead to.
And osteoporosis.
That's one.
Osteoarthritis.
Incorrect. But you did get osteoporosis. So it also causes rheumatoid nodules, dry eyes and mouth, infections, carpal tunnel syndrome, heart problems, lung disease, and lymphoma. Okay, and Mallory, which one do you choose?
Patho up for 300.
Okay. List at least 2 groups that are at highest risk for RA. So think of the types of people that are at the highest risk. Like, is it their diet? Is it?
Obesity.
Okay, that's one.
And smoking.
Yeah.
Correct. Okay, Haley, which one do you choose?
Headed to 200.
Okay. What are the main symptoms for RA? Just list a few.
Inflammation and stiffness.
Correct. So, yep, painful. The full list is painful, warm, and swollen joints, joint stiffness, and then most often in the mornings, and then tiredness, and then inflammation is also one of them. Okay, Sean, which one?
Head to toe for 300.
When should you see a provider for RA?
Uh,
Think of time frame. How many weeks can you have these symptoms when you should see a provider?
3 weeks? 4
Correct.
weeks?
Amazing. Correct. Okay, and then Valerie, your turn.
System impact for 300.
Does RA affect systems other than just the joints? Yes or no?
Yes.
Correct. It can also affect other places too. Okay, and then Haley, you're up.
I'll do subpapio for 400.
Okay. What part of this is affected by rheumatoid arthritis?
Like what part of the body?
Correct.
Okay, the hands, wrists, and like, I just want to say like knees.
Yep.
Yeah.
Yep, joints, hands, wrists, knees, ankles, feet, and toes are also, so you got the point right. Sean, it is your turn.
System impact on organs for 400.
What systems does RA affect other than just the joints? List at least 3.
Musculoskeletal. Respiratory. And cardiovascular?
Is that your answer?
Yeah.
Okay, so heart is right. The musculoskeletal system is correct because that is one of the true ones. And then what was your other answer?
Cardiovascular.
Yeah, that was 2.
And the lungs, so the
The lungs.
respiratory.
Perfect. You guys are all pretty close in points. Okay, Mallory, you're up.
Head to toe for 400.
What 4 head-to-toe assessment procedures are used? And these are things that we were taught in health promotion.
So the neurofunctional.
Think of more like basic, like are you inspecting? What else are you doing?
Pain assessment.
Just like generalized, like so you got inspection.
Range of motion.
Yes, that's one.
Temperature of skin.
Not that one.
I don't know.
Okay. Well, you were close. You got two of them. But the full list is inspection, palpitation, range of motion, and strength. You'll be performing those in your peripheral and upper extremities. Nurse can also perform a neurological assessment for the sensation and reflexes as well. So you actually did get the neurological right, so you got 3 out of the 4. Okay, and then Haley, you're up.
Okay, I'll do clinical manifestations for 400.
Okay. List at least 2 early signs and symptoms of RA.
Joint tenderness and just stiffness, I guess.
Yep, joint pain and tenderness, and then, yep, and stiffness is one of them. I'm going to give that to you. There we go. Okay, Sean, you're up.
Clinical manifestations for 500.
List at least 4 complications of RA without treatment.
Joint stiffness, pain, immobility, loss of range of motion, musculoskeletal issues, or like osteoporosis.
So osteoporosis was right. Deformed joints. Some of the other ones, unfortunately, the questions you got the question wrong. You can also have viral infections, heart disease, lymphoma, carpal tunnel syndrome, and interstitial lung disease. But you were close. Got 2 out of the 4. And then we have the last one up. This one will go to Mallory.
Just pass over 500.
Okay. Not a whole lot of options there. What type of treatments are available for RA?
Therapies,
Mm-hmm.
PT, OT.
Are there any medications available?
No, antibiotics.
No.
Pain medicine.
Pain medications could be one of them. Think of, are there any drugs that help with inflammation?
Blanking on it.
It's all good. Well, I'm going to give the answer. The type of treatments would be, it depends if it's long-term or short-term, but NSAIDs, corticosteroids, JAK inhibitors, and then disease-modifying anti-rheumatic drugs. So that is it. In conclusion, we have Haley as the winner with 1,300 points, so congratulations. We don't have any prizes, unfortunately, but that is it. And,